How is India faring? Close to 2,000 cases, 38 deaths. Not bad for a country for 1.3 billion people, you could say. But it's too soon to say that. On Gravitas tonight, we take a close look at India, the hurdles and the silver linings. First, the challenges. The Tablighi Jamaat event has posed the biggest hurdle for India. 3,400 people attended the 4-day event in Delhi last month. So far, the congregation has been linked to 200 infections and 8 deaths. In Delhi alone, 53 attendees tested positive. 234 people from the state of Tamil Nadu attended this event. 190 of them are coronavirus positive. There's been one death too in Tamil Nadu. Attendees have also tested positive in Telangana, Andaman and Nicobar Islands, Jammu and Kashmir. The biggest challenge before India now is to trace all the domestic attendees. They must be tested and the positive cases need to be isolated. It does not stop there. Those who came in contact with the delegates also need to be traced and tested urgently. It is essentially the race to trace them. Challenge number 2, population. We are a country of 1.3 billion plus people. Maintaining social distancing in a country so populous is a big challenge in itself. Look at India's population density, 382 people per square kilometre. There isn't enough space. In Mumbai, 120,000 people share 1 square kilometre of space. 120,000 people. This spells nothing short of disaster when dealing with a contagion. Challenge number 3 for India is healthcare. The country does not have a well-equipped healthcare system to combat a pandemic like this. There are just 70,000 intensive care unit beds. That is less than 2.3 ICU beds per 100,000 people, 2.3 beds for 1 lakh people. India does not have enough ventilators. There is no official figure. According to estimates, the number of ventilators in India ranges between 25,000 to 40,000. That's for a population of 1.3 billion. Clearly not enough. The total number of government beds available in India is a little over 7 lakh, which means there are 0.55 beds per 1,000 people, half a bed for 1,000 people. Hygiene or the lack of it is another challenge. We are being told that washing hands with soap and sanitizing our hands regularly are the only way to prevent the coronavirus. But in India, only 36% of the households wash their hands with soap before consuming food. 26% do not wash their hands with soap even after defecation. These grim numbers are from India's National Sample Survey Office. That said, every cloud comes with a silver lining, and India too has its share of successes in this fight. The United Nations, the unprecedented cooperation, in fact, has been India's biggest success. The country has come together to fight this pandemic. Private companies have volunteered to make masks and sanitizers. Firms are helping set up hospitals. Some are providing free meals, and some are giving free internet services. And it's not just India Inc. Every individual is doing his or her bit in helping others tackle the hard times. Thousands across India are donating food, money, drinking water to the poor. People are making generous donations to PM Cares, which is the Prime Minister's fund for the fight against the coronavirus. India has also been successful in breaking the chain of infection thanks to the timely nationwide lockdown. All non-essential services have been closed since the midnight of 24th March. It's a 21-day lockdown. Its implementation has been fairly good. India has also been successful in spreading awareness about the virus and social distancing. Bollywood actors, political leaders, sports stars, they've all taken to social media to talk about the importance of self-isolation. People are following rules, maintaining a 1-arm distance while lining up outside grocery stores. There are exceptions, yes, and there are many, many challenges, which I'm sure you've seen. But there is a plus side too. Indians are going out of their way to help others in trying times like these. It's little good gestures like these that help a country sail through difficult times.